All right, so we're going to talk about needling the lumbar spine today. So when you're going along the spine here, you're going to be going through multiple layers of tissue. So the most superficial layer are those erector spinae muscles, and then deep to that is going to be the multifidi, and then even more deep to that, you have all the little muscles that are kind of running segment to segment. We're going to be pretty close to the spine here, and I'll talk about how far away we're going to be. So we're sticking kind of in this region. The way I like to palpate and figure out where I am, I think the easiest way, it's an old trick from Jeff Moore, is if you find PSIS on each side and then go right in the middle and call that S1, you can work your way up from there, okay? So if I have that and work my way up and I find the vertebrae or the segment where I want to go, there are going to be some considerations whether you're at the top of the lumbar spine versus the bottom part of the lumbar spine, mainly because of where our kidneys sit. So if you remember from your anatomy, your kidneys are going to be from about T12 down to L2-ish on the right side. The left one can even go down a little bit further, maybe towards L3. So when we talk about how far away from the spine to be, when I'm a little bit higher up on the L1, L2 segments, I'm going to be a little closer to the spine. And then as we get a little lower, we can actually go a little bit further away. So we're going to talk about distance as it relates to finger breaths. So it's the patient's finger breath though. So Kyle and I have roughly the same size hands, so I can use my fingers as well. If someone has much bigger or much smaller hands, I'm going to need to adjust that from just using my own. So if I want to do something, let's say around the we'll say L3 level, I'm going to go through, I will find my PSIS on each side, call that S1, and then I'll come back up. The next vertebrae spinous process I feel is L4 or L5, then L4 and L3. So I have a good grasp of that spinous process. I'm on that spinous process, and what I want to do is, now that I'm L3 and below, I can be 2 finger breaths away. So 1 finger, 2 finger. I like to angle a little inferior or a little caudal and a little bit medial. So a little bit here and a little bit down. And I can go right in and I can insert and work all the way down until I feel a bony backdrop. So I'm going to come down and I start feel boom, I hit bone there. Then you can do a little periosteal pecking right on it. And then a lot of times if I'm going to add some E-stem or some other things, I like to go ahead and get a little bit of twist so it grabs some of those fibers, and then now I'm good. And I can work, let's say, multiple segments up and down the same side, or I may end up working both sides depending on what I'm working with. So that is needling considerations for the lumbar spine.